Hello and welcome to our lab demo. My name is Lily Nelson. I'm going to be playing the part of the occupational therapist today.
Hi, I'm Chrissy Rolfe, and I'm going to be playing the part of Jessica, the patient, today.
And I'm Lauren Mueller, and I'm going to be playing Patrick, Jessica's husband.
And let's begin. Hello, Jessica and Patrick. It's nice to see you. I just wanted to start off by getting a general idea of your pain today. Jessica, on a scale from 1 to 10, 1 being the least amount of pain you've ever experienced and 10 being the worst pain you've ever experienced, how would you rate your current level of pain today?
Hi, I would have to say currently my pain is around a 7.
Where is this pain located?
In the area of my recent leg amputation, it's kind of like red and irritated.
She has mentioned this pain a lot in her leg ever since the surgery, and it's concerning. Was supposed to help alleviate a lot of the pain.
Yeah, that can be concerning. Jessica, an intervention I would like to introduce today is the pain diary. I also want to look at how you write the pain diary. So I want you to write the location and severity of your pain at different times throughout each day, during and after certain activities that you do. This will help all of us gain a better understanding of what activities increase your pain, as well as give us a way to track how often you have pain and the intensity of the pain.
That sounds like a really good intervention to me. Just to clarify, you want me to record at what specific times of the day my pain is the worst, where my pain is coming from, and exactly what activities seem to increase my pain?
That's correct. The layout of the pain diary shows you what to do and at what times you need to fill it in. If Patrick wants to be involved, he could help you remind you throughout the day to assess your pain during different activities. The format is pretty simple and easy to follow, but if you have any questions or concerns, please feel free to ask me.
I think this will be really helpful because I know Patrick worries about my pain, and this is a way for both of us to keep track of it. And I also know that it'll give Patrick a peace of mind so he doesn't worry as much.
Yes, I do worry about her a lot, and her pain, and I want to be able to help her and be involved as much as I can be. So I think this diary could be a great tool for the both of us.
The pain diary is going to be more of a homework assignment for Jessica, but during our time today, I want to focus on your new prosthetics and address some important aspects related to them. So just how to clean them and taking them on and off. How do you feel about trying them out and getting to learn a little bit more about taking care of them?
I'm super excited to try out my prosthetics and learn the ins and outs of how to properly.
She is really excited about trying them and using them. We've talked about it a lot at home, and I'm happy for her. I think we both know it'll take some time and work, but hopefully they will help her get back to doing things that are important to her and to us as a couple.
Yes, there will definitely be time and learning involved, but I'm confident that you can do it, Jessica. So the first aspect I want to discuss is putting on and taking off the prosthetic. I know this can seem complicated at first, but with practice it will get easier over time.
I am about taking it on and off, and I know that it will take some time to get used to, but I have Patrick to help me now if I need it. I would like to be able to do it independently as soon as possible.
Yes, it is reasonable at first to assume that you may need some assistance, but the goal is for you to be independent. First step is putting on the compression sleeve. You're always going to want to make sure you use the compression sleeve because it helps to ensure the best fit in the prosthetic. When you pull the compression sleeve over your amputation site, you want to make sure that fits smoothly and is not bunched up. This is where you could have Patrick help if you need it at first. As demonstrating the picture, you should sit down and have your residual set on a flat surface for stability. Then fit the sleeve over your leg using both hands. I'm going to show you a picture. Do you see that? So You keep the shrinker sock pulled taut and smooth. Don't let it bunch or wrinkle. And the man is using 2 hands for this activity. It's important to pull the compression sleeve taut and smoothly, because if you do not, the little bunches could cause your skin to be irritated, and after hours and days of wearing the prosthetic, it could cause bruising or cuts, and that would not be good. When you put the liner on, it might be a little uncomfortable at first because the amputation area isn't used to it or built for the sensation or pressure yet of it. In previous sessions with you, we've worked on desensitizing the area, and you'll get more comfortable over time, and we can continue to work on desensitization techniques if needed. I'm also going to show you what the prosthetic looks like. So here is a picture of the below the knee prosthetic. You place the liner / compression sleeve on here at first. You fit this over your amputation, and then you put the liner in your leg into the socket, the white part here. And then you strap the liner onto the socket with this little white strap here. And just to show you that this is the pylon, and that's the leg part, and then this is the foot that you'll have to walk around in. It's important to strap the liner on because it will help you walk around without the liner falling out of the socket.
The picture of the below knee amputation was really helpful. I'm getting a clearer picture on how to put the compression sock on and make sure that it doesn't get all bunched up because it could cause like irritation around my stump. And the picture of the prosthetic was also really helpful because now I understand all the different parts of my prosthetic. I can't wait to really try it out.
So I would like to show you a video on how to don and doff your prosthetics. I'm glad that you're excited about trying your prosthetic. After watching the video, I'll provide you the link at the end so you can use it for future reference. And I'm going to share my screen with you guys and have you watch the video.
Hi guys, this is Christina, the amputee OT. In this video, you get to see how I put on and take off my prosthetic. I am an amputee and this is my prosthetic leg. This is a cover over the prosthetic leg. It is sleeve art. Underneath is fiberglass shell. This is a temporary leg. I'm going to get a definitive leg made, but people generally have to go through several sockets before they get their final leg. And to take off my leg, I press this pin and my leg slides out. This is what a prosthetic looks like on the inside. You can see there's a hole down in there where the pin goes. This is a liner. This liner has a pin in the end, which goes into my socket. On the inside of the liner is silicone or gel. The thing that the pin is attached to is called an umbrella. To put your leg on first, you have to pull it out like this so that it's mostly flat. Then you put it against your leg and you press it on and you roll it, making sure that you don't get any air bubbles inside. Now you can see the umbrella and the pin. Because my leg is shrinking, I have to wear socks, which fill out some of the volume in my leg. And this makes the socket fit better. After I have all my socks on, I slide my stump into my leg and then stand on it. Once you hear those clicks, you will know that the liner is locking into the socket. There. Now as I walk, it will click more. And that is how you put on a prosthetic. Okay, that's all for now. Be sure.
That video was very helpful and provided me with lots of information. I'm definitely looking forward to watching it again later when I'm going to be practicing putting it on and taking it off when you're not around.
Great.
Yeah, I think that would be a really helpful source for us to refer back to when you're not around and we need a reminder.
Great. Now I would like to address some of the common concerns that come about when it comes to taking care of your prosthetics and exactly what you need to do to properly take care of them.
I know that's something that's been really concerning for both of us.
Yeah, that sounds really good to me. I have been really concerned about how to exactly take care of my prosthetic because I really don't want to damage them. They were super expensive to begin with and had to be fitted properly to me, which took a lot of time. I would also assume that there are some very important rules to follow when it comes to take care of them to make sure that they don't get damaged.
There are important rules. I will show you how to care for your prosthetic. The prosthetic should be cleaned daily with soap and water and a sponge. It's important not to submerge in water as this can damage your prosthetics. The socket of the below the knee prosthetic is important to clean thoroughly. It's also important to clean the shrinkers and liners of the prosthetic daily, as well with soap and water. You can submerge these in water. I would also suggest clean them at night before you go to bed so that they have time to dry overnight.
I feel so much better now about taking care of my prosthetics. You've provided me with lots of information on how to properly take care for them, as well as showed me exactly what I'm supposed to do when caring for them. I now have a really better understanding of the different parts of the prosthetic as well. I just have a quick question for you. So when cleaning my prosthetic, what kind of soap would you recommend I use to clean it with?
I would recommend using unscented dish soap. That's the best to clean it. In addition to caring for the prosthetic, you need to also take care of your residual limb. If the limb is not properly cleaned, it can lead to issues with your skin integrity. Check the skin around your residual limb daily. Notice any cuts or bruises that could be irritating you. Use a mirror to check behind your knee. You could also have Patrick check behind your knee for how the skin is doing to look at it. Another thing to be careful of is sweat management. The moisture in the sleeve can lead to rubbing and friction that can be painful and cause skin breakdown. I recommend using the prosthetic at least every 2 hours and wiping down the limb and the inside of the liner to remove excess moisture and allow time to dry. If areas of the skin continue to look worse or become more irritating, please seek medical advice. It's important to keep checking these things because if you do not, it could lead to an infection.
I do have some experience with my prosthetics, so I am aware of a lot of those little things, and I am willing to check spots that she might not be able to see as well. I have 2 liners that I switch between. Will Jessica also have that?
Yes, she will have 2 liners, and it will be important to alternate liners because after cleaning them, you should allow them to dry for a full 24 hours to make sure all the moisture is removed to prevent chafing.
That sounds really great. I'm glad to know that I will have 2 liners that I can switch between. The information on taking care of my residual limb will also be super helpful as I continue to use my prosthetics and want to prevent infections.
Before ending our session, I would like to discuss a home exercise program that I've developed for you to do outside of our therapy sessions. I'd like you to perform this program once a day for a total of 4 weeks. Over the next 4 weeks, I would like you to practice donning and doffing your prosthetic twice a day to show what you have learned about donning and doffing the prosthetic and demonstrate your knowledge learned about prosthetic care by cleaning your prosthetics daily with a clean sponge, soap, and water. And it's also important to remember to use the unscented dish soap. Please, thank you, for doing that, asking that question. Also, don't forget that I would also like you to fill out your pain diary daily.
Thank you so much for all your help today.
Yeah, thank you so much for all of the information that you've provided us throughout the session. It was really helpful in improving and increasing